This is Naija Health Education Series. Theme: Eye Care 360 with Dr. Tenman Pamshak Elisha. Raising an informed healthcare community, empowering you with the right information required for making informed healthcare choices. Powered by DAP TV Nigeria with support from Friends of Good Health. Naija Health Education Series. Raising informed healthcare community.
Okay, so we'll be looking at refractive errors in children, and most importantly, our interest for today will be to discuss or to look at myopia. Now, myopia, it's one of the refractive errors that children get to have, and we all get to know that myopia can also be referred to as nearsightedness or short-sightedness. And when we say nearsightedness or short-sightedness, simply means that the person is comfortable doing things that are nearer to them than seeing things that are far away from them. So therefore, these children are see things that are closer to them better off than those things that are far away from them. So those children having this kind of symptoms are referred to as children who are having myopia or who are myopic as a form of refractive error. So how prevalent is this myopia that is even of a concern to us as eye care personnel? Now, myopia itself, it's being estimated that by the year 2050, about 50% of the world population children are going to be having myopia. Now you get to see that this percentage or this estimation is actually quite alarming. And that is what is bringing us to this talk, where we'll get to enlighten parents. We talk about understanding the risk factors on why children get to have myopia and how we'll be able to help in reducing the prevalence of this myopia and the complications that come as well with the myopia. So why are we concerned with myopia itself? Our concerns with myopia, it's simply because of the fact that myopia can get to result into reduction in performance in school for the child. Why is it important? It's simply because if a child is myopic, it means that the child educational performance can be affected. And when the child educational performance is affected, is that child is not able to see things that are far away from him. So if the position that this child is sitting in class is not appropriate, it means that the child will not be able to see what the teacher is writing on the board, what they are saying in class, or what is being projected on the board in class. And therefore, it affects this child's performance in school, and therefore educational performance tends to reduce. And interest in wanting to go to school always for these children will be affected, and therefore their educational performance will also reduce. Now, myopia is also of importance to us because these children tend to be reserved. Many a times they don't want to go out and talk to people or do things with people outside. They're only interested in doing things indoors. So when you want them to go outside, they are not interested in going out because things that are far away from them are things that they don't get to see properly. So therefore, interest in carrying out activities outside tends to be limited. Now, these children, when you give them work to do, they are almost always interested in bringing this work very close to their eyes, as if they are burying the book in their eyes before they'll be able to see and perform what they want to do. Or you get to see them complaining of aches. When you force them to see things that are far away from them, they begin to have their eyes being deviated. Alright, so these are the things that are making us to be concerned about this myopia as a form of refractive error. And again, outside that, we get to see that because of the fact that this can also be related to other complications that can get to occur in the children. So we're interested in reducing the progression of this myopia in these children because of complications like glaucoma can get to occur in children that have myopia, and we know that glaucoma itself can result into irreversible blindness, right? So we are ensuring that these complications don't get to set in. Now, complications like macular degenerations can occur in them, and they can also get to have things like retinal detachment. In retinal detachment, you get to see that the retina at the back of the eye tends to detach, and that gets to affect vision, and then these children don't get to see very well. So when we pay more attention or put interest in myopia, it's now going to help us to avert these things from happening in these children, and then they will get to enjoy their vision for a very long period of time. What are the risk factors that could make children to have myopia? Some of the risk factors for myopia in children can occur as a result of hereditary factors. When one parent or two parents have myopia, now these children are at risk of also developing myopia. When you have one parent having myopia, a child is at risk, about 2.5 times at risk of developing myopia. When the two parents are having myopia, then the child is almost like 5 times at risk of developing myopia. So we get to see that hereditary factors can predispose children to developing myopia. Then again, when you also have these children spending too much time indoors, they are at risk of developing myopia. When children get to spend less than 2 hours a day outdoors, almost every time they are inside the room, now those category of children are high risk of developing myopia. Now we're not doing any good or favor to these children by always telling them, no, stay back inside, go and watch cartoon, don't go and play outside. You don't want them to play with the children of the neighbors, you don't want them to do this, you don't want them to do that. So that kind of style gets to predispose our children to developing myopia, because they are not outside, the sun is not stimulating the retina. There are chemical agents in the eyes that when the eye gets in contact with the sun, gets stimulated, and then when the retina gets stimulated, they produce those chemical agents that tend to control the growth of the eye in these children. Okay, so again, when we are encouraging children to do too much near work, they are at risk of developing myopia. Every time you are giving these children your phones, you are giving these children your tablets, they don't do anything else that is far away from them, but they are always on the phone, always on the tablets. Now these children are at risk of developing myopia because of too much near work that they get to do all the time. And again, some other environmental factors can predispose these children to the development of myopia. Now, how do we help these children? How do we help to prevent this myopia from occurring? Now, we need to work towards prevention. When we work towards prevention, and then those that eventually get to have the myopia, then we work towards how can we now control or treat this myopia that they've had. Now, in preventing these children from having myopia, now we've talked about the risk factors that predispose these children to the development of myopia. Some of these risk factors are factors that can be modified. Some are not modifiable. You've already married your wife or your husband who already has myopia. You can't change that. So the hereditary part of the risk factor for the development of myopia might not be changed easily. Okay, but when you have factors like the time spent outside, when the children are spending less than 2 hours outdoor, then when you want to prevent myopia in those kind of children, then you have to increase their outdoor time. You make sure that they get to spend a lot of time outside, playing outside, where the sun will get to stimulate the eyes and then stimulate the retina, and then substance that will inhibit the overgrowth of the retina gets to be released, and then that gets to control the outgrowth of the retina itself. Now, when you also get to have discourage children from carrying out too much near work at a time. Now you give them a distance, they walk for nothing less than keeping the book or material that they are studying not less than 30 centimeters away from their eyes, and then for every 2 hours that this child does a walk, this child should learn to take breaks in between. Like to take breaks in between work, not to start work from morning to evening. They are always on the screen, they are always on the phones. That will predispose them to myopia. So if you want to reduce that or prevent that, you reduce their contact with these near work activities. They should also work towards reducing the children's screen time. And you tend to be able to reduce children's screen time, when you reduce their rate of exposure to their visual devices, the phones, the tablets, the laptops, the televisions and the likes. So they spend less time in contact with those visual devices and then spend more time outdoor. This will help in reducing or preventing the development of myopia in them. Okay, so we can also help to reduce this by also adjusting other environmental factors that are within our reach. Now, what happens if in the event that we are not able to prevent this child from developing myopia, and then this child ends up developing myopia? So having myopia in them, it's not a death sentence. However, myopia can progress. Myopia can progress because of the fact that as a child, the eye is in a continuous growth mode. Eye is a continuous growth mode. As the child is growing, the eye itself is growing, right? So when the eye is growing, it is elongating, it is becoming bigger. So, and usually it's expected that some substances will be stimulated and released in the eye. These substances tend to halt the overgrowth of the eye so that the children don't get to develop myopia. Because in the development of myopia in them, most times is that the eyeball tends to outgrow itself. When the eyeball tends to outgrow itself, when the rays of light come into the eye, they don't get to be focused on the retina. Because the eyeball is bigger than the normal size, so the rays of light now begins to focus in front of the retina. And that tends to give these children a blur vision. So one of the symptoms they present with is blurry vision. So if this tends to occur, what can we now do as healthcare personnel or as parents? Now, most parents always shy away from wanting their children to wear glasses. They will begin to tell you that, okay, I have not worn glasses at this age. It was only when I became adult I was wearing. Why should my child start wearing glasses at this age? No. Now, don't deprive your children the opportunity of wearing glasses that will help to prevent the development or the progression of myopia in them. Once there's a prescription of glasses and your healthcare personnel tells you that, okay, this child is going to benefit from glasses, the onus is on us as parents to advise and to pick up these glasses so that we can help these children's vision in the long run. So one of the things that we help to do in the management of the myopia is that we work towards correcting the myopia. How do we correct the myopia? We correct the myopia by the prescription of glasses. We prescribe glasses which helps us to correct myopia. These glasses can come in a form of eyeglasses. It can come in a form of contact lenses, depending on the age of the child, depending on what we want to correct for the child at that time. Okay. Now, and in these glasses that we're giving to these children, we expect them to wear these glasses always, all the time, except when they want to sleep or when they want to bath, then they can take them off. Otherwise, the glasses should always be on their faces, because this will help us with correction of myopia. This will help us to ensure that the retina is always being stimulated by a clearer vision, not a blurry vision. Because if the vision tends to be blurred for a prolonged period of time, these children can get to have what we call amblyopia at the end of the day. So you want them to wear spectacles that will help them to see clearly always. Okay. So outside that, we also want to give these children intervention that will help to control the myopia. So when you correct the myopia itself, it is not the end of the danger. Because in correcting the myopia, you only give glasses, right? So these glasses that you give, the eyeball is still growing. So it means that the power of these glasses is likely to change after a few months or after a year. So you have corrected the myopia for clear vision. You need to control this myopia so that the progression will not be out of place. So there are interventions that we get to do that will help in controlling this progression of this myopia. And what are those interventions? There are the ones that you can help us to do as parents. When this child has myopia, has been given glasses, we've told you what you can do in prevention of myopia. You allow this child to have enough time outdoors, more than 2 hours. you allow this child to have breaks in between near walks, you tend to reduce the screen time for these children as much as possible. And when you do that, it helps in reducing the progression of the myopia for us. Outside that, we can also get to give these children medications or eye drops that they can use. These eye drops are being given instilled in the eye, 0.05% of atropine every night. Now, this helps in reducing the progression of myopia in them as much as possible. So, after correcting the myopia, we also want to control the myopia so that it doesn't get out of hand. You don't want the power to become so much that the children will end up start wearing very thick glasses at a very young age. So you want to control this myopia for them. And then we want to manage this patient or these children holistically, in the sense that we ensure that all aspects that could lead them to myopia has been looked into. All things that could be done to modify has been looked into. We also want to encourage schools to ensure that the classroom is well lit, because when the classroom is well lit, now children get to see well, and then performance in school gets to be better. So when constructing classrooms as well, we want to encourage that modalities should be looked into where there will be enough or proper or appropriate illumination that will get into this classroom, so that these children could get to enjoy their academic activities without having to predispose them to the development of myopia. So myopia itself is not a death sentence. There are risk factors to it. There are complications that can come if we don't do anything about them. And the good news about it is that we can correct myopia for children by giving them glasses. We can control the myopia itself and prevent it by ensuring that we encourage children to have enough time outdoors. They go to the park, they go to the beach, they go play outside. You reduce their near walk time, maintain a good near walk distance, about 33 centimeters from the eye, and then they take breaks in between when they're doing their near walks. This will help the eye to be in good shape even as they continue growing, and you continue having clearer vision and enjoy and live to the fullest of their potentials. So glasses for children is a yes for us if there is a need for it, and if it will help in preventing other complications of refractive errors in them, and it will also help in increasing their academic performance. So the impact will be massive in these children. My name is Dr. Tenmang Panshak Elisha. I'm a pediatric ophthalmologist with you today. Thank you.
This is Naija Health Education Series. Theme: Eye Care 360 with Dr. Tenman Panshak Elisha. Raising an informed healthcare community, empowering you with the right information required for making informed healthcare choices. Powered by DAP TV Nigeria with support from Friends of Good Health. Naija Health Education Series. Raising informed healthcare community.